Hey, what's up? It's Brandon. Welcome to my channel, my blog, or my corner of the internet, wherever you happen to be watching from. I'm certainly glad that you're here. So, what I'm going to be doing today is the first in a series of videos that I'm calling Symptom Check. And what I'm going to do in these videos is give you a detailed profile of a mental health symptom that you may be experiencing or are just curious about. And then I'm going to talk about its causes, what you can do about it, helpful medications, and give you some tips on how to talk to your doctor so you can be proactive about your needs, which is the most important thing to me. So, as you can see from the title, the symptom we're going to be talking about today is psychogenic itching. If you'd like, there is a trigger warning or content warning in the description box below, so you can make sure that there's nothing you're uncomfortable with that I'm about to be talking about or showing you. So, with that said, I'm going to talk about itching on its own first. And itching is most often caused by histamines. And that's it's just a chemical that your body releases, like when you get bit by a bug, or things like dry skin, an allergic reaction, and things like that. That is the most common cause for an itch. There are different types of itching, like proprioceptive itch, that is terrible, which is due to inflammation, dryness, or skin damage. And that is something that you would see with hives, eczema, psoriasis, or reactions to drugs, mites, and dry skin. This type of itch is often treated with antihistamines because it is a histamine that is causing that itch. There's also neuropathic itch, which is triggered by neuropathy, which is tingling or numbness, basically, caused by damage to the nervous system. You can see this with shingles after stroke or a burn injury, and then in just a random area of itchy skin. And that is treated with non-narcotic analgesics and capsaicin. So that is a topical numbing agent or something that will warm the skin to stop it from itching. There's also neurogenic itch, which comes from chronic liver and kidney diseases, and it's in response to opioid neuropeptides. And that is something that you would see with like pain or, your body, like toxins kind of blocking your nerves and things like that. And that is something that would be treated with a narcotic or a non-narcotic analgesic, which again is a topical numbing agent for the skin. And then, of course, there is what we're talking about today, which is psychogenic itching. And what that means is it's an itch that is based on or caused by a psychological abnormality such as just stress. It's a common response to depression, anxiety, or psychosis. Often in pop culture, we see that crazy person, they're just itching and that sort of thing. So like a drug withdrawal or psychosis is what we see with that. And that is psychogenic itching. Now, the causes for it, like I said, are like stress, depression, things like that. It's not to be confused with dermatillomania, though, which is a compulsion and also, often comes with like a hallucinatory type sub-symptom of, thinking there's something in, on, or under your skin that other people cannot really see or are not experiencing at the same time as you are, that's causing you to pick at the skin. So, psychogenic itch is described in the DSM as an excessive impulse to scratch, gouge, or pick at normal skin. So again, we go back to dermatillomania is sort of in line with this, but also can come with that perceived abnormality or abnormalities in the skin, like scabs or sores or things like that. Psychogenic itching is on normal skin. That is the big defining difference. But the two can go hand in hand if your itching creates wounds, or it can also come with dermatophagia, which is eating your skin or like chewing yourself or things like that. It's typically diagnosed only after every other symptom can be ruled out, like an allergic reaction, skin irritants such as soap, lotion, a chemical in your work environment, or just things like that. This is something that I would bring up to my mental health professional if I knew that I was itching in times of stress, anxiety, sadness, things like that. Anyone that has had issues with self-harm in the past or currently, if you're experiencing itching on normal skin that's causing, urges to harm yourself or things like that, that's when I would definitely bring it up with a doctor. And a lot of studies about psychogenic itch say that it's caused mostly by depression. I have notes right here, I apologize. But it's also associated with OCD, mania, and substance abuse. And also, anxiety is a big, big factor because it's an absent thing that you can do. Even when you feel fine, a lot of times people do nervous behaviors such as biting their nails. And then in the case of a psychological abnormality, that can escalate to trichotillomania, which is hair pulling or picking, or trichophagia, which is chewing your hair, chewing your skin, dermatophagia, or dermatillomania again. So any skin picking or hair or fidgeting or things like that, even when you personally don't feel that you're experiencing an anxiety, it's a it's a compulsive urge to deal with those feelings. Psychogenic itching is something that I personally have dealt with, and what I'm going to do right now is I'm going to show you some scars where I itched and it is healed on my hand. So you see right there, and then of course on the back of my hand here, I'm like not sure how to do anything. And then also I have this, which is a wound right now. It's kind of gnarly looking, and then a scar right here as well. So I'm trying not to mess with the wound at all, but I didn't notice I was itching my skin away. The itch was still there. I just scratched and scratched and scratched, and it still itched almost to the bone. And I noticed I was doing this. The first time I did it, I was actually under the influence of alcohol, and I thought that maybe I was just experiencing anxiety because I had taken my medication earlier that day, and antidepressants don't really mix well with alcohol, even though it was just one dose and one very small drink. I was nervous, and so I was itching. I have also noticed itching when, I feel perfectly fine, but I'm doing something that makes me nervous, or the day before a doctor's appointment, or things like that. So I've itched even when I feel okay. And that is a big thing. You might feel fine, but you're having this impulse to itch as a symptom of anxiety. The itchiest parts of the body from this are often face, arms, legs, hands. And that's because they're the easiest to reach. Data also shows that there is there is also a link between itching and pain. So pain, you burn yourself, you're like, ah, and that's like what you do, you like back away from it. So when you experience an itch, all you can do is scratch it. It's a reflexive response. So if itching is your reflexive response to anxiety, and then your subsequent reflexive response is going to be to scratch that itch. So we have to treat the itch. Of course, it is important to treat the underlying psychological abnormality, whether it is just general stress in your life or a more severe mental illness like psychosis, schizophrenia, or something along those lines. So the first thing that will be done, most likely, is the itch is treated by itself, because it takes longer to cure the underlying cause. With effective counseling, therapy, whatever techniques are most helpful for the patient in question. So the medicine that will most likely be prescribed for this, is an antihistamine. such as Atarax, which is hydroxyzine hydrochloride, or Vistaril, which is hydroxyzine pamoate, or something as strong as Ativan, which I do not know the actual name of, I apologize. And what those are sedatives, so they have a calming effect on the brain because they depress the nervous system in high doses. Not that these are recommended unless directed by your doctor. They can also be used as a non-addictive alternative to sleeping pills, and they do have an antihistamine effect. So when you take these drugs, it depresses your nervous system, and then it goes in there and it eats up those histamines. It's like munch munch on your histamines, and you're not itching anymore. So, and a good way to approach this with your doctor is to tell them, you get itchy, and tell them that it's like some people bite their nails, but you're itching. Definitely express that it's a compulsive behavior or an impulse in any way that you feel comfortable to do so. Because psychogenic itch is something that is so seldom diagnosed, because we look at everything else. If your hand itches, you're like, well, I did dishes the other day and the dish soap has a drying effect on the skin, or maybe I used that new soap I got on sale, or, we find other reasons. But if you're experiencing excessive itching and your skin doesn't appear dry or red or anything like that, and you only experience it at certain times, definitely bring it up to your doctor. And of course, make sure that you're drinking plenty of, fluids, and, be mindful of what you're using on your skin, but also be mindful of your symptoms and your mental health needs. So, I hope that was informative. If you have any questions, there will be additional information which I hope is helpful to you down below. There will also be the sources that I got my notes from, so you can go ahead and read those for yourselves, although I did sum them up fairly thoroughly. And I will add any other resources that I can find, and GoodRx coupons to the medications that I spoke about in this video. And as always, if you have any questions, comments, feedback, or would like to share your experience, go ahead and do so in the comment section below, and I look forward to seeing you next time. Thanks.